According to research from the Commonwealth Fund, approximately 125 million Americans are either underinsured or uninsured. This means roughly 35% of the American population between the ages of 19 to 64 is either subjected to unreasonably high health costs from providers that don't handle expenses with reasonable coverage, or not covered by insurance at all. If a healthcare is a right, these statistics sure don't seem like it. Let's continue to break down these stats. The number of uninsured Americans is staggering. In 2003, it was reported that 45 million American adults had no health insurance at all. Additionally, 16 million American adults were underinsured. Uninsured statistics from the U.S. Census in 2018 don't fare much better, with a whopping 27.5 million Americans reporting being without insurance for the entire calendar year, and 7.9% of the population reporting they were underinsured or uninsured. When someone is underinsured, major, devastating, and unforeseen healthcare expenses can be unjustly high. We expect our insurance to give us peace of mind through all of life's uncertainties, but let's face it, life is hard. That's why we invest in the first place. But how can it really be trustworthy when it's so situational and flippant? This doesn't seem like a fair trade-off. Healthcare should always be as accessible and affordable as possible, no matter the condition. The line that defines the insured and uninsured population loses its differentiation due to recent trends that place complications on financial security. What we mean by that is that cost sharing and out-of-pocket expenses are rising for everyone. Surprise billing, the lack of healthcare transparency, is making things a bit risky, unreliable, confusing, and disappointing. This is not only a threat to the financial aspect of healthcare, more importantly, it's a threat to healthcare as a whole. When the cost of care is way too expensive, it places boundaries and closed doors to optimal health and well-being. Underinsured or uninsured people probably don't have access to prescription drug coverage, dental, or vision benefits. These are all basic and necessary routines that shouldn't be up for debate. The term uninsured can be a bit murky. There seems to be a lack of information, research, and study that can yield a clear definition. However, as the Commonwealth Fund states, an uninsured person can be identified as one who has health coverage all year but also meets one of three conditions. 1. Annual out-of-pocket medical expenses amount to 10% or more of income. 2. For low-income adults with income under 200% of the federal poverty level, out-of-pocket medical expenses amount to 5% or more of income. Or 3. Health plan deductibles equal or exceed 5% of income. Remember how we said that high healthcare costs is a major threat to healthcare as a whole? Well, it's no secret that underinsured people will just skip out on their needed treatments and prescriptions altogether. More than half of the uninsured as well as underinsured population go without necessary care because it's simply not an option for them. The financial stress is just too demanding and unbearable. In fact, nearly one-half of the underinsured population reported being contacted by a collection agency due to unmanageable financial medical bills. Lifestyles have to be changed in order to accommodate for such weighty expenses. We know we can't single-handedly reform the healthcare system overnight. But what we can do is help you be prepared, aware, researched, and knowledgeable. That's a promise. ZMed works to equip you with the right knowledge needed to rise above. With ZMed, you can shop for healthcare price and service options rather than just crossing your fingers and hoping for the best. Financial insecurity is too much of a big problem to approach blindly, so we've got your back. Check out our app at zmed.com and see how your options for care can be tailored to your needs.